So I want to talk about Achilles tendonitis. Achilles tendonitis is something that we see very regularly in clinic, and it's classified by a thickening of the tendon, a reddening of the tendon, a stiffness of the ankle, and generally pain on movement. Achilles tendinopathy is quite interesting because it tends to linger, and it can linger for years, even decades sometimes. And what you'll find is that when you start to develop a Achilles tendinopathy, the pain will go completely upon rest. The problematic thing is when you start running again, the pain comes back almost immediately. And the reason for that is that often there is a breakdown in your biomechanics, so the way that you run. So when we run, what needs to happen is when our foot is out in front of us, our foot needs to pronate. Think of it like the cat's whiskers, where the 28 bones in the feet have to unlock, and we have to feel for the topography, we have to absorb impact. But when my leg is behind me, the 28 bones of the foot, together with the 3 arches of the foot, have to lock together, and then I need to push off it. Generally speaking, what happens with an Achilles problem is that there is a compensation. So the Achilles and the calf are compensating too much because of a breakdown in the biomechanics elsewhere. The most common breakdown of the biomechanics actually happens in the hip. We lack internal rotation, which is necessary when my hip goes backwards. And so rather than supinating my rear foot to push off, I'm actually, in a sense, I'm pronating still. Because I'm pronating, I'm actually pushing off on my calf more than I should. That constant pushing off on my calf more than I should, the additional compensation, causes irritation and constant trauma, micro tears in the Achilles. Now, the problem with Achilles tendonitis, and in order to get patients better, 2 things need to happen. Number 1, we need to restore the normal biomechanics. So the injured Achilles doesn't have to do more work, it can just do the work it's supposed to do. So it's no longer having to compensate for a breakdown in the biomechanics of the knee or the hip. So that's the first thing that we need to do. And the second thing we need to do, unfortunately, takes a little bit of time. And the time that is taken is that the scar tissue build up over time in the Achilles is very brittle. It's not very well adapted, unfortunately, for elastic motion. And so what we need to do is actually get you moving again and getting loading up the Achilles. This will break a little bit of the scar tissue, and then you have to allow that to heal, and then you do that again and again. And what we find is that over time, the scar tissue will remodel to more of an elastic structure, and finally you'll be able to run again.